Well, experts say there's been an increase in issues related to alcohol use and addiction. Is it related to the pandemic? And if so, why?
And what can you do if you're facing challenges to your sobriety? Charlie Smith, a recovery coach at Archway House, is with us to discuss the important issue. And Charlie, the first question, how does this pandemic lead to more substance abuse?
Well, good morning, John and Rachel. And first, thank you for taking time out of a busy news cycle to have me on this morning. Look, I see it this way. All of the conditions that contribute to substance abuse, alcoholism, and addiction are really magnified right now. I consider those, depression, anxiety, worry, fear, uncertainty. And so, what is substance abuse at its core? It's a chemical solution to an emotional problem. And so when the sufferer is relying on drugs and alcohol to deal with those emotional issues, something called a craving kicks in. And what happens is the next thing is the unmanageability. And what do I mean by that? I mean, what I want to happen after I've consumed drugs or alcohol doesn't happen. Or worse yet, what I don't want to happen happens. The DUI or the domestic violence incident or perhaps the financial irresponsibility. And so the sufferer, having shame and guilt over those situations, needs more drugs and alcohol to deal with that shame and guilt. And unfortunately, without an intervention or having some kind of awakening, those situations can be fatal for the sufferer. And it's sad.
It is. And there are probably a lot of people out there who are finding themselves turning to alcohol or other substances right now to just handle the everyday stress that everyone's feeling. How do we make sure it doesn't turn into an addiction? And what are our own personal warning signs?
Well, it's a great question. I mean, what I always look for is when somebody's having negative consequences associated with the use of a substance and then they continue to use that substance despite those negative consequences, it's a real warning sign. We all have kind of emotional regulation built into us, and if we can tap into that and use some of the resources that are out there today to help us deal in a healthy way with those emotional cues, I think we have a much better chance of avoiding the temptation to use drugs and alcohol as a way to cope with some of the fear and anxiety that's out there. I really suggest everybody have some healthy routines even during this time. They can be a grounding thing for everybody to have some healthy routines, and then, have hope. I will tell you, for me, John and Rachel, hope is just the inherent belief that something good is going to happen. When I keep that mindset around, I'm actually much more inclined to engage in those healthy behaviors. So I try to practice that mindset myself and encourage others to as well.
And Charlie, as a person in long-term recovery and a recovery professional, what would be the warning signs that people should be aware of if they think they're falling into some kind of substance abuse issue?
Well, again, it's continuing to see negative consequences. I always look for my primary relationships become affected, whether that's my significant other, my spouse, my partner. I start to see myself becoming irresponsible, meaning that, I'm not keeping the commitments that I have to myself and to others. And I start to develop that shame and guilt when I wake up in the morning and kind of have that feeling of, I wish I didn't do that, yet I see myself doing it again. Those should be big red lights and warning signs for people to, maybe talk to somebody about their substance abuse or alcohol consumption, John.
Important topic. Charlie Smith, thank you so much for taking some time out to join us this morning.
Great conversation.
Thank you,
Charlie. Meanwhile,